Hello friends, now moving to the next part of discussion from our pharmacology of autocoids basically. We have discussed in our previous video about the treatment of gout and the drug which are involved in the gout. Now in this particular video, we are starting with arthritis. Okay. So coming to the arthritis, first giving you a brief introduction about the arthritis, that is, it is a chronic inflammatory condition. Okay, you have read in your pathology videos. Now, what happens here? Lymphocyte causes formation of interleukin 1, TNF alpha like this, and it will cause joint destruction, that is arthritis. Clear? Basically, it is an autoimmune disorder. These are the basic points. Now coming to the important point, that is treatment of arthritis. So first we will treat acute attack, then we can also give definitive treatment. Okay. So for acute attack treatment is just symptomatic treatment. We are just treating the symptoms. Okay. Now here drug of choice is NSAID. Okay. Except paracetamol. Paracetamol have very weak anti-inflammatory effect, so we usually not give paracetamol. Clear? Other NSAIDs are given. Clear? Drug of choice is NSAID. Now drug of choice, these NSAIDs are also given in pregnancy. Okay, only drug given in pregnancy. Clear? This NSAIDs. Suppose if there is no response by giving NSAID, then you can give corticosteroid. Okay, intraocular injection of corticosteroid is given. Clear? And corticosteroid, one important point, that it also decreases your joint destruction. So these two drugs are basically, you have to remember, for symptomatic treatment, that is acute attack of arthritis, we can give NSAID and we can give corticosteroid. Clear? Okay, no problem. Now coming to the definitive treatment. So in definitive treatment, we give usually immunosuppressant, that is also known as DMARDs. Okay, disease modifying anti-rheumatoid drugs. So this is usually asked in your short notes. Write a short notes on DMARDs or SARDs, that is slowly acting anti-rheumatoid drugs. Okay, and these drugs are contraindicated in pregnancy. Remember this. Clear? Now coming to the DMARDs. So divided into two groups. The first is your older or conventional, and the second group is biologicals or targeted therapy basically. Coming to the first drugs. Okay, so its mnemonic is Malika, Shrawat, Pagal, C. Okay. Now M for methotrexate. The first drug is your methotrexate. Mechanism of action, it just inhibits DHFR, that is dihydrofolate reductase enzyme, and it also causes adenosine efflux. Clear? So this methotrexate will be drug of choice for rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. These three have drug of choice as methotrexate. Methotrexate is also an anti-cancer drug. We will discuss this drug also in our anti-cancer video. Clear? Dose is 10 to 25 mg per week. This dose is very important because this is a common drug. Okay, dose will be 10 to 25 mg per week you have to give, and along with this methotrexate, you should add folinic acid also. Okay, to prevent the toxicity of the methotrexate. Remember this. Okay, folinic acid you have to add to prevent the toxicity. Clear? Now side effect, most common side effect is your mucous ulcers. Okay, then megaloblastic anemia will be there, bone marrow suppression will be there, hepatotoxic. Most common is mucosal ulcer, along with it megaloblastic anemia, bone marrow suppression, and hepatotoxicity will be there. So this is your methotrexate. Clear? This is contraindication in pregnancy and lactation. Okay, these drugs are contraindication in pregnancy and lactation. Now, so this is your first drug, that is in product or conventional classification. Okay, we will discuss biologicals after discussing the older classifications. So the next drug is your sulfasalazine. Okay, this is a sulfonamide. Okay, this is basically prodrug activated by bacteria in colon into sulfa, pyridine, and 5-aminosalicylic acid. It goes into blood and it is used for treatment of rheumatoid arthritis. It has local action in GIT, and it can be given for the treatment of ulcerative colitis because of the local action in GIT. Side effects, so decreases sperm count, sulfa allergy, then bone marrow suppression will be there. Okay, other drugs which are used in treatment of ulcerative colitis are colsalazine, mesalazine, valsalazide, like these drugs. Clear? Mechanism of action, so it inhibits lymphocyte division and it also decreases production of interleukins. Okay, it inhibits the lymphocyte division and decreasing the production of interleukins. Clear? Now the next drug is your penicillamine. Okay, penicillamine is also used in treatment of Wilson disease because it is a copper chelator 2. Then gold. Okay, out of this, because this drug is out of use because of too many side effects. Okay, most common side effects: diarrhea, then dermatitis, then DLE, then damaged kidneys. So remember 4D. Okay. The next drug is your azathioprine and other anti-cancer drugs such as cyclophosphamide, cronbucil, cyclosporine. All these drugs will be discussed in our anti-cancer video. Don't take attention for that. Okay, it is used for even for the treatment of extraarticular manifestation of RA and for methotrexate resistant cases. So for methotrexate resistant cases, we can give azathioprine and other anti-cancer drug. Clear? Okay, the next drug is your leflunomide. Its active form is teriflunomide. Okay, and it is given for treatment of multiple sclerosis as well along with RA. Mechanism of action, it inhibited pyrimidine synthesis. Okay, by inhibiting dihydroorotate dehydrogenase and by inhibiting thymidate synthase. Clear? So these two enzymes are inhibited by this drug, leflunomide. Okay. Now, so this is about your leflunomide. Clear? Leflunomide. This is about your leflunomide, action of leflunomide. Now, coming to the next group of drugs. Okay. Now coming to the next group of drug, that is your biologicals. Okay, so in biological, the first group is your TNF alpha inhibitors. Okay, drug is infliximab. Just remember infliximab, very important. Then certolizumab, adalimumab, golimumab, etanercept. This all drug. This infliximab is given through IV, or you can give this drug subcutaneous also. Okay, but the remaining drug, that is certolizumab, adalimumab, golimumab, or etanercept, this is given subcutaneously. Clear? Remember like this, I cage. This is the cage, suppose cage. Okay, and this cage you are locked up in this cage. So I cage. And uses, so drug of choice for methotrexate resistant rheumatoid arthritis. Then it can given for ulcerative colitis, psoriatic arthritis, ankylosing spondylitis, and sarcoidosis. Okay, trick is Rupaj. R for rheumatoid arthritis, ulcerative colitis, psoriatic arthritis, ankylosing spondylitis, and sarcoidosis. Side effects of TNF alpha inhibitors are, first is infusion related injections. Okay, means infections. So infusion related infections will be there. Then hepatotoxicity will be there. So it is contraindicated in hepatitis B infection. Remember this. Then it also leads to reactivation of latent TB. Hence, before giving infliximab, remember this, we have to do Montex test. Clear? This is very important clinical point. Then it also give you SLE like symptoms. Clear? This is the structure of infliximab. Okay, Fab portion, Fc portion. This is made up of TNF alpha receptor of mouse, and this is from human immunoglobulin. And this is the structure of etanercept. This, okay, only TNF alpha receptor is there. No Fc portion is present in your etanercept. Whereas in infliximab, Fc portion is also present. Now the next biological, so first biological we have discussed, that is TNF alpha inhibitors. Okay, now coming to the second biological is your interleukin 1 blocker, in which you have to remember one drug, that is anakinra. You can also remember the other, that is canakinumab, but not so important. The interleukin 6 inhibitors, it includes tocilizumab and sarilumab. CD20 inhibitors include rituximab. Just remember the names of the drugs. Okay, then Janus kinase inhibitors, tofacitinib and baricitinib. Okay, tofacitinib and baricitinib. Tofacitinib inhibited JAK1, JAK3 both. Baricitinib inhibited JAK1 and JAK2. Clear? And these are only oral biologicals. Okay, rest of all other biologicals are given by injection. Remember this. Only biologicals are JAK inhibitors, which is given through oral route basically. Then the next is your co-stimulation inhibitor. Okay, you are knowing, you have read in immunology that CLAD4 on lymphocyte binds to CD28 on other lymphocyte. Okay, clear? And it inhibits, and basically these drugs will help to inhibit the co-stimulatory effects. Clear? So we, okay, so CLAD4 analog we can give abatacept. Okay, new drugs is your belatacept. Just know the names. Abatacept, belatacept are co-stimulation inhibitors. Okay, clear? Now coming to the chloroquine. So these were the biologicals. Okay, 6. Now coming to the chloroquines. So chloroquine mechanism of action is, it also decreases interleukin 1. Okay, not used in severe cases, highest volume of distribution among all, and it can cause side effect like bull's-eye retinopathy by depositing in retina and causes permanent blindness. Okay, so new drug is derived, that is hydroxychloroquine. Here less risk of bull's-eye retinopathy is there. Okay, so we have derived new drug like hydroxychloroquine, which has a lesser risk of bull's-eye retinopathy. Clear? So this is about your drugs. Okay, now going to osteoarthritis. So for pain, we usually give paracetamol, is drug of choice, very important. We can give other NSAID as well. For inflammation, levothyroxine or diceram is given. and intraarticular injection of corticosteroid and hyaluronic acid is also there. Okay, so this is all about your arthritis. So thank you for watching. If you have not subscribed my channel yet, please subscribe us and support us. Okay, we will continue to keep posting such important videos. Okay, thank you.